Good morning. Good afternoon, everyone. And welcome. Thank you for all joining this seminar today, tackling emerging infectious threats through innovative collaboration in the era of climate change. As all you know, climate impacts on health are becoming serious and increasingly evident. And we are here to exchange insights, share experiences, and explore ways that we can collaborate in the future to develop effective strategies and moving forward in the context of climate change resilience, especially with a special focus on dengue fever. Today, we'll hear from several experts who bring valuable perspectives from their fields. Each will share their insights on their work, followed by panel discussions about the collaboration opportunities in the future. So now, a quick housekeeping message and announcement before we begin. We are now using a microphones and some audio facilities, but in case if you have a problem in listening or hearing the sound difficulties, please let us know by raising a hand. So the staff will give you our headsets. And please turn off or in silent mode, have your mobile phone in silent mode so that minimize the disruption. And also, we'll have a Q&A section at the end of panel discussion. So if you have any questions, please feel free to note down that you may have, note down any questions you may have. Okay, thank you once again for you all. And now let's get started. So first, we'll have opening remarks by Mr. Yutaka Matsuzawa, Vice Minister for Global Environmental Affairs, Ministry of the Environment, Japan.
Thank you all for joining us for this event. But I appreciate the keynote speakers, Maria Neira from WHO, Director of Environment and Health, and presenter, Ms. Takako Oyab from the Takeda Corporation, and as a panelist, I appreciate for your contribution in advance. Increases in extreme climate events increases disease risk. Increases in heavy rain and temperature will increase the risk of dengue fever and malaria and other waterborne diseases in tropical and subtropical regions. Japan has long been working to address climate risks to human health. In particular, we see high international expectations with regard to measure resolving infectious disease, including dengue fever. In today's seminar, various stakeholders such as international organizations, WHO, of course, and private companies gathered to discuss the importance of climate change and health and the potential for public-private cooperation in order to further promote adaptation to climate change impacts in the health sector. Through this seminar, we hope to raise awareness about the importance of promoting intersectoral collaboration in adaptation measures, as well as to provide an opportunity to begin preparing for future infectious disease crises. Thank you very much.
Thank you, Mr. Matsuzawa. So now we are going into keynote speech. The keynote speaker is Dr. Maria Neira. She's a director of the Department of Public Health and Environment, World Health Organization. Dr. Neira, please come to the podium.
From here or from here? This one. Okay. Thank you. Good morning or good afternoon, everyone. What a pleasure to be here. And certainly, thank you very much to the organizers. Thank you very much, the government of Japan. And thank you very much to the Minister of Environment in Japan, because for the health community, it's such a pleasure that the health demand is coming from another minister, from another sector. So the fact that the Ministry of Environment is giving the keynote to the health people is really a great pleasure, and it proves this importance of the One Health approach. I hope you will, I will try to be very short on my presentation, not making sure that I will capture your attention as long as possible. But this is what I would like to discuss with you, something that probably is very much known by everyone, but let me talk about the latest. Let me repeat once again our kind of mantra. Climate crisis is a health crisis. And it's a health crisis because if you look at the vulnerability factors, demographic, geographical, biological, sociopolitical, socioeconomic, health system capacity, gender equity, all of them. And if you add all the climate-related hazards that I will not describe because they are in the headlines of all the newspaper every single day now, including my own country, Spain, affected very recently by flooding and extreme weather events. If you add that the exposure, how we are exposed to that, that will result on very painful health outcomes, from injuries and mortality from extreme weather events, no need to describe how this happened, to heat-related illness. Again, you have heat waves now reaching very much our communities, respiratory diseases, waterborne and water-related health impacts, vector-borne, zoonosis, malnutrition, pneumonia, non-communicable diseases, and mental health, which unfortunately is very much affected as well. And in addition to that, when you look at our health systems, at our health facilities, you will see that once they are not properly prepared to cope with the consequences, and second, that our own health system generates and contributes by 5% of the global carbon footprint. So no doubt, climate change increases the transmission of deadly infectious diseases. Particularly, the transmission increases in dengue, and I know that Japan is particularly concerned about dengue, malaria, West Nile virus, many others that I don't need to go through because the list is really very long. The point is that this can happen in the existing places and even in new ones that we were not expecting this problem. And the climatic suitability for the transmission of dengue by Aedes albopictus or Aedes aegypti increased by 46.3% and 10% respectively. So I think this is a big percentage that we all need to keep in mind and trying to address this problem jointly, environment, health, and of course, zoonotic diseases, animal health as well. So the transmission potential only for dengue increased over 27% since the 1950s, 27% increase. I think this puts our health systems and our health of our citizens very much at risk. The same for malaria transmission is very much connected, not only with the temperature and rainfall pattern, but as well the extreme weather events have been shown to cause rapid spikes in the number of cases. So climate-related displacement is another issue associated with that, and the gathering behaviors aggravate the disease transmission. The more people you put together, certainly the potential for exposure and transmission will increase. So why? Because the rising temperatures increase the rainfall and extreme weather events create the perfect conditions for those pathogens and their carries, and they lead the increase in risk for diseases such as dengue, malaria, cholera, which is a waterborne, and West Nile virus. the changes that the climate change is inducing on our ecosystems, such as obviously deforestation, habitat loss, and altered water resources, push the wildfire to have more contact with humans, and that will as well facilitate this jump from animals to humans. And those effects are obviously multiply and amplify when your population is on a low-income region or is especially vulnerable, or they are already on displacement, overcrowding, and places where the poor sanitation is very much the daily life for these people. Let me say something that we are trying to repeat consistently from the beginning of this COP29 and before. Health is the argument for climate action. I think health will be the one that talk to people, motivate people, is something positive. If you prescribe health, then you will obtain enormous benefits, and particularly this transition to renewable sources of energy, and the technology is helping us very much, as you can see here. Transition to sustainable food system, transition to healthy urban planning. The health benefits we can obtain are enormous. This is the report that WHO has presented, and you can download it. And then we need as well to make sure that it's not only the argument, but we put it on a very tangible way by incorporating health into the national determined contribution at country level with very specific guidance that you can see in the other document that WHO has the pleasure to launch at the COP. You know, there are tools. When people say, okay, how we adapt our national system to cope with climate change consequences, well, we have developed very nice tools looking at how to build future-proof health systems and how to have low-carbon, climate-resilient health systems that fit for purpose, because the ones we have now, they are not responding to the challenges of this century, because they need to cope and adapt to climate change and at the same time reduce our own emissions. So I'm not going through, but these building blocks of health systems are already published and of course at your disposal, and we will be very happy if the countries endorse those recommendations by the World Health Organization. We did a survey in 2021. I think you will have an interest in looking at that. We were looking at the number of countries among our survey countries that reported having a health surveillance system in place. Obviously, a health surveillance system that will be looking at the diseases that we want to target. And among them, how many of those will include meteorological information? Because this is fundamental. We need now to work together. And in fact, WHO has been looking together with the World Meteorological Organization to make sure that we are not missing those meteorological information, which is fundamental within our health systems. And you have the results there. Those who are not including meteorological information are those in blue, and those who included are those in red. So you can see that we still need to do a big effort to further incorporate this meteorological data. The same for looking at another survey where we were looking at health and climate change. And then we realized that 1/3 of countries reported having climate-informed systems in place for vector-borne. So it's important to have a system for dengue or other, depending where you live, you need to focus on those diseases that are more probable to happen. And then vector-borne, waterborne, airborne diseases, or heat-related illnesses. And you see the responses. The percentages of countries that reported collaboration between the Ministry of Health and other institutions to strengthen evidence on research on climate change and health can be improved. Let's say that there is room for improvement. So that's why I'm so happy of this collaboration with the Ministry of Environment, because this collaboration is fundamental. We did as well a review of health in the national adaptation plans, because this is where action will be taking place at the national adaptation plans. When people talk about including health on the national adaptation plans, we have very good results. Almost everyone talk about health on the national determinants, but one thing is to talk about it, and one thing is incorporating it. And you see that in the NAPs that include the mentioned the climate sensitive health risk are many. It's a big percentage, almost 91%. But then when you look at the light blue or green, I don't know how you see it, it's between blue and green. When you look at that, the results are a little bit different, and definitely, again, much room for improvement. My time is up, so just to let you know that we are very happy and proud that Japan recently launched ATTACH, which is the Alliance for Transformative Action on Climate and Health. And ATTACH was launched in 2006, at the COP 2006. And since then, we have been advancing very much. I will not describe, but for those of you who are not yet members, please join. I know that Japan is taking this very seriously and with a huge commitment. And we are very happy to say that ATTACH not only is generating very good partnership, 91 countries, 70 partners, but it's generating positive energy because people want to work on something that is motivating and having tangible results. This is my last one. You can download the reports that we launched. And again, this is the demonstration why we think that health can be the argument, the powerful argument for more climate action. Thank you very much.
Thank you, Dr. Neira. Next is a presentation by Ms. Takako Oyabu. She's the Chief Global Corporate Affairs Sustainability Officer, Global Corporate Affairs, Takeda Pharmaceutical Company Limited. Ms. Oyabu, please.
Hello, everyone. Thank you, Ministry of Environment, for the invitation. I'm very honored to be here with you today. So I will discuss 3 ideas today. One is that for Japanese companies, sustainability is an evolution rather than a revolution. Second is that climate change is a business imperative. And third is how partnerships and collaboration is an enabler. So did you know that more than 40% of the companies that have been around for more than 100 years are based in Japan? This is really an exemplifier of how Japanese corporations manage short-term business goals with long-term business aspirations. It really reflects how value is creating business value. One principle that Japanese corporations have followed is called sampo-yoshi. It's called third-party satisfaction, meaning how it's good for the seller, good for the buyer, and good for the broader society. Takeda is one of these corporations that followed this principle. We were founded in 1781, just 5 years after the US gained its independence. And we follow our founding principles today in a business framework called patient, trust, reputation, business, in that order. What do I mean by this? If we focus on patients and providing them with life transformative treatments, this really helps build trust with patients and different stakeholders, which helps build our reputation. And by following this business framework, we can grow our business. How we developed and think about access of our dengue vaccine is really an example of this approach. And my colleague Derek will discuss this even further in the panel discussion today. I often get asked by people, why as a biopharmaceutical company are we focused on climate change? And let me be very clear, it's because it's business. It's because climate change impacts not only our patients, our people, and the communities that we serve. And as you can see in this slide, the Japanese government is committing or aiming to reach net zero by 2050. The private sector will play a very important role in this, in achieving this. The private sector not only will have to cooperate in terms of innovation, industry collaboration, and public and private partnerships. At Takeda, we aim to decarbonize or achieve net zero in scope 1 and 2, our operations by 2035, for our value chain by 2040. We really have an ambitious commitment because we truly see the linkages between climate change and human and people health. That is why we are committed as a company not only to use our core business to deliver life transformative treatments to patients and people, but also to reduce our own carbon footprints. And beyond the efforts, we do collaborate with the Japan Climate Leaders Partnership. This is a coalition of businesses in Japan, 245 of us, to really take action around climate change in Japan. And I think it's through really these collaborations that the Japanese companies do exhibit enduring values and try to balance not only business needs, but societal needs as well. Our over 240 years of history has taught us that delivering impact really takes time, it takes perseverance, and also the need of collaboration. And this is why we really value partnerships, both in the business side as well as our philanthropic side. As you can see here, since 2016, our global CSR program has had 34 projects around the world, touching 93 countries. Out of these projects, currently there are 5 that are focused on climate and health. Takeda's 50,000 employees around the world get to vote on these programs. We have an annual voting system, and we have our strong commitment against these programs. Our philanthropic partnerships that really help climate resilience, it's happening in the Caribbean as well as Southeast Asia. And we are also tackling health impacts that have been started because of climate change in sub-Saharan Africa as well as South America. So there are really no quick fixes on building climate resilience or really achieving public health. And this is why it's very important for us to really partner with organizations that have really strong values. And by working together, we can make real meaningful progress and create a sustainable society for all. So thank you very much, and I look forward to our panel discussion.
Thank you very much, Ms. Oyabu. So now we have heard from the international organization and the pharmaceutical company. So now we are going into panel discussion from all panelists. So could you please, panelists, come onto the stage? Moderator is Mr. Yukihiro Heiser. And then also one more panelist online, Mr. Junichi Takahashi. Okay, I'll hand over the microphone to Mr. Heiser. He is the moderator. So Mr. Heiser, please.
Thank you very much. And thank you very much for joining us today. I'm Yukihiro Heiser, Climate Science and Adaptation Office in the Ministry of the Environment, Japan. I will be a moderator today. And having heard a very good presentation from Maria-san and Takako-san, we can directly get into the panel discussion. But my plan is to separate this panel discussion into 3 rounds. The first round, we are touching on the current issues on the ground in terms of health-related health-related impacts of climate change. So please explain what is your target core targets are being affected by climate change in terms of human health issue. So you can touch on broader issues rather than focusing on dengue in the first round. But before answering to this general question, please introduce yourself and your organization, how your organization is related to climate change and human health impact. So I would like to ask the first speaker to, I think, Junichi Takahashi-san from the Ministry of Health, Labor, and Ministry of Health. He's now online. So Junichi-san, could you take the floor?
Yes. So can you hear me? Okay. Thank you very much, Haisa-san, and good afternoon from Tokyo. I'm Junichi Takahashi, Director of the Office of Global Health Cooperation of the Ministry of Health, Labor, and Welfare of Japan. I would like to first express my gratitude for inviting me as a panelist today. I really wanted to be there, Baku, but I was unfortunately unable to attend in person. So, even online, I am very pleased to join discussion from Tokyo today. So the primary mission of the Ministry of Health, Labor, and Welfare of Japan is to protect the people in Japan by guaranteeing and improving the lives of the people and improving and promoting social welfare, social security, and public health. Nowadays, even when we promote domestic health policy, international collaboration has become indispensable, and the ministry is required to address global health issues, including addressing the impact of climate change and health to achieve its core mission. So recognizing these circumstances, we published Global Health Vision of the ministry in August this year. And it is uploaded to our ministry's website. So if you are interested, please take a look. But this vision describes our understanding of impact of climate change on health as following. So the health impacts of climate change extend beyond direct factors such as heat stroke and floods. It also alters the distribution of infectious diseases like malaria, affects food security through its impact on agriculture and livestock, causes rural depopulation and urban slum growth due to large-scale population movements, and increases the risk of zoonotic disease outbreaks due to wildlife migration. The effect on global health, including Japan, are extensive. Furthermore, large-scale movements of refugees due to climate change are anticipated in the future, increasing the need for humanitarian assistance, including healthcare needs. So this is our assessment of impacts of climate change on people's health. With this daunting view in mind, we consider that climate change and health is one of our most important issues, and we are making efforts to addressing it. This is why we participated in the first climate and health ministers meeting held at COP28 last year. And as Dr. Nader of WHO stated in her keynote speech, in May this year, we, Japan, formally joined the ATTACH, the Alliance for Transformative Action on Climate and Health. Even in Japan, rising temperature due to climate change is affecting the distribution range and activity of arthropods, such as mosquitoes that transmit infectious diseases, and their distribution area is expanding. The habitat of mosquitoes that transmit dengue viruses is no exception. And if the temperature continues to rise, the active period of Aedes albopictus may become longer. So while it is necessary to strive to accumulate scientific knowledge on the causality because between the rising risk of infectious disease and climate change, we are keenly aware of the need to promote both international and domestic efforts with the points I have mentioned in mind. Yes, this is our basic view, and thank you very much.
Thank you very much, Junichi-san. And following Junichi-san is Anna Maria from Gavi. And I'm just saying the order. And after that, Danilo-san from UNICEF Brazil, and Derek from Takeda. So please, Anna Maria, take the floor.
Very good morning. And the first thing to say is to really a big thanks to the Minister of the Environment of Japan for the invitation. So what I would like to do is to introduce my organization, Gavi, the Vaccine Alliance. And if we can start with the presentation, that would be really good. Gavi was founded in year 2000. And the most important objective was to redress a big inequity that was existing in the world, which was that many vaccines that were reaching the children of high-income countries were not reaching the children of lower-income countries. So at the time, we started financing 6 vaccines, and now we are proud to say that we facilitate the purchase of 19 vaccines to low-income countries at much more affordable prices. So the first thing to say when you hear about Gavi, if this is one word that you should remember is alliance. We are an alliance. And if we can go to the next one, please. Yeah. I'm sorry, I have to do it. I'm so sorry. I forgot the instructions. So the alliance works in partnership. We're a public-private partnership. And as you can see on a slide, our core partners are WHO and UNICEF, who work with us on the ground on the 57 countries that we work with. But we also have other important actors. Our main partners are governments of these 57 countries, but also the World Bank, the Bill and Melinda Gates Foundation. We have in our board civil society organizations, academia, also the manufacturers, the industry, and research as well. And all together, we work in this partnership to provide life-saving vaccines to children. So we exist since year 2000, so we have 24 years working, and I'm very proud to say that in those 24 years, we have reached 1.1 billion children with vaccines. And that has enabled saving the lives of more than 18, or almost 19 million lives. This is a contribution not just to health, but also to the economy, because this generated economic benefits of 250 billion. That's the calculation. We also have a model in which we co-fund the vaccines. So at the beginning, when we start working with the government, we pay for most of the vaccines, for most of the prices. But then throughout the years, there is a plan in which the government shares the costs to have a final point in which they graduate. And there are 19 countries who have done that through the history of Gavi. So there is much more to do. This is my last slide. Unfortunately, that inequity persists, even though we are bringing vaccines to countries. There are 21 million children under-immunized. That means children who have not received all the vaccines they should. But, and this is a very important figure, 14.5 million children in the world have not received any single vaccine. So humanity can go to the moon, but we cannot vaccinate of our children. And that is something that we really need to correct. We have there, the universe of children that were born in 2023, 130 million. So the work continues. And this is more or less the proportion of children living in different countries in the world. So to close that immunization gap, Gavi has now approved our new strategic period 2026-2030, in which we plan to vaccinate 500 million children. And for that, we are fundraising. We need to do that. We need $9 billion at least. And we hope that we will get there. But it's a very important mission. I'm very proud that I've been able to share it with you now. Thank you.
Thank you very much, Ana Maria. And please take the floor, Danilo-san, and tell me what is happening on the ground in Brazil.
Well, thank you, everyone. Good afternoon, I guess. Well, my name is Danilo. I'm the person responsible for running the climate and environment program for UNICEF in Brazil. I am the so my presentation became much easier after Dr. Nader spoke, because about several of the things I was hoping to try to explain, I won't have to explain. So I'll just move right along to say, in UNICEF, our understanding is that climate change is not changing just the climate, it's changing people, and climate changing is changing children. And changing children means children are exposed to risks. They carry a burden related to the climate crisis that is completely disproportionate to the fact that they are the least responsible for the climate crisis. Children are the additional burden of disease that Dr. Nader was describing earlier. 88% of that additional burden will fall on children under 5. There are 1 billion children in the world, pretty much half of all of the children, who live at extreme risk, high risk to the impacts of climate change. And those numbers give us a sense of the challenge to children that climate change poses. Climate change threatens children's rights on multiple fronts. And at the same time, the response to those challenges is underwhelming. Our estimate is that 2.4% of all climate finance goes to projects that have impact on communities and children and services that are essential to children. That combination of effects means that we are not doing enough to respond to how climate change is affecting children. I won't go into the details of everything that is in my slides, because I added more things than I have time for. But I wanted to say that our understanding is that climate change poses a threat. It creates pressures on systems that are already failing or that are already fragile. Every system that ensures children's rights is under threat. So education systems are under threat when the Amazon has the worst drought in its history, and children that live in remote areas can't get to school because they need the rivers to get to school, because they go to school by boat. And so we have 400,000 children in the Amazon right now that are suffering the worst drought in history. They impact children's health when right now this generation of children is dealing with 7 times more heat waves than the generation of children that was born in the 1970s in Brazil. And children are the ones least able to cope with extreme heat because their bodies are less able to deal with extreme heat. We see those impacts when you see a catastrophe related to climate, and suddenly the rates of child marriage increase, because that's how families exposed to extreme events respond. Their worlds become more chaotic, and then children suffer. When you have extreme events, violence against children increases. When you have extreme events like droughts and extreme rain, the sanitation and water systems are pressured, and even in places where they exist, and 30% of children in the world live without proper access to sanitation and water. But even in places where they exist, those systems start to fail because of climate change. So the point here is climate change changes children in a way that creates a threat to all their kinds of survival, to all their rights, and to all the things they need. And we'll talk a little bit more in the panel discussion about what kinds of solutions we are proposing. But I think it's important to highlight how the specific needs, children are vulnerable and they have specific needs that need to be met in these discussions about climate change and the response to it, and they are not being met right now. Thank you.
Thank you very much. So Derek, please.
Hi, everyone. My name is Derek Wallace. I am the president of Takita's dengue vaccine division. And I'm going to talk a little bit about some of our health priorities, which are mainly focused around dengue, because we have a dengue vaccine and it's one of the innovations that we can bring to the fight against the health impacts of climate change. So dengue is a disease which is a vector-borne disease, which is driven by climate change, also by urbanization and globalization. Essentially, as mosquitoes become more prevalent and the interactions between people and mosquitoes gets greater, there will be more dengue. And we've seen about 8 times more dengue over the last 20 years. So there's an 8-fold increase in dengue over the last 20 years. That's getting worse in terms of places that we classically associate with dengue, but it's also spreading of dengue to places that we don't associate dengue. Japan's had local outbreaks of dengue. Taiwan's had local outbreaks of dengue. Portugal, Spain, Italy, Florida, Texas. So this is a disease that is going to continue to get worse. And it's not a disease that we can manage through simple interventions. Essentially, dengue is not a disease that has a treatment. So it's essentially a supportive treatment. When somebody gets sick with dengue, all you can do is manage fluid balance and fever. So we really need to think about dengue in terms of prevention. And to prevent dengue, we need multiple modalities. We need to think about good clinical care, robust surveillance, sustained vector control, vaccination, and we need to communicate with communities to help them understand how to prevent dengue. And this is all very much aligned with WHO's position on arboviral initiative. In terms of Takita's contribution, we have a dengue vaccine, TAC 003. This was first registered back in August of 2022 in Indonesia. And since then, we have registration in more than 40 countries. And you can see them represented here in the red on the map. We've had reviews from a number of different NITAGs, National Immunization Technical Advisory Groups, such as Conitec in Brazil, who have currently a public program. In fact, nearly 90% of the doses we've distributed so far have been in the context of public programs. This is, we believe, the best way to manage equity in a disease like dengue is to let governments decide how best to use the vaccine. So we have public programs in Brazil, and we have public programs in Argentina, as well as some city-based programs in Indonesia. In terms of global views on the vaccine, WHO's SAGE has provided their position and recommended the use of the vaccine, starting in high-intensity settings. For example, where peak of hospitalizations is in the range of 6 to 16. Importantly, this vaccine can be used without screening, and I think that's an important move, important sort of innovation in the field of dengue vaccination. PAHO has adopted the vaccine. We've had distribution of the vaccine in Honduras and Peru earlier this year, and we have pre-qualification with the World Health Organization. I'm not going to talk about these things now because I think they're more important from the panel discussion, but we think about our role as Takita is to work through partnerships to have an impact on public health through reducing the burden of dengue. We also feel a responsibility to continue to generate data on how to assess impact, but also how to maximize impact of this intervention. And we're also looking at how do we build capacity to manage the huge volumes of doses that might be required. This is not a disease where you vaccinate 2-year-old children or 6-month-old children for a life course. This is a life course vaccination. And this has a completely different requirement in terms of volumes of doses than traditional vaccines. So thank you.
Thank you very much. And I think we have a very perfect set of presentation, and now we completely understand the situation. There is a vaccination gap and severe impact on children on the ground, and there is a kind of new or innovative solution, which is dengue vaccine. And we need some collaboration or partnerships to broaden our efforts. And my original intention was to separate this panel discussion into 3 rounds, but I think we are running out of time. So let's have another round, starting from Junichi-san and the 3 of us. So could you please merge your possible intervention into one? You will have 3 or 4 minutes each. So yeah, let's do. Let's start from Junichi-san. Could you take the floor?
Yes, thank you again. With regard to the second question, the entire government of Japan promotes the adaptation measures to climate change in accordance with the Climate Change Adaptation Act. For this purpose, the Ministry of Environment of Japan compiles a climate change impact assessment report on the impact of climate change in various fields, including health, once every 5 years, and formulates and implements an adaptation plan based on the assessment results. The latest report assesses a risk surrounding the situation where the increase in temperature may change the distribution area, population density, and activity of arthropods that transmit infectious diseases, and that may affect the endemic area and the number of cases of arthropod-borne infectious diseases. This assessment report concludes that such risk is significant and urgent. So based on this recognition, in order to prevent the occurrence and the spread of not only dengue fever, but also mosquito-borne infectious diseases, we are working in Japan to take measures such as continuous fixed point observation in risk areas of mosquito-borne diseases, measures to prevent source of larvae, extermination of adult insects, and alerting people on mosquito control measures. In addition, as part of Japan's global health policy, the government of Japan recognizes the need to address neglected tropical diseases or NTDs, including dengue fever. For example, the Ministry of Health, Labor and Welfare and Ministry of Foreign Affairs of Japan have contributed to the Global Health Innovative Technology Fund, or GHIT Fund. There is a public-private partnership originating in Japan since its inception in 2013. This is to support the development of new drugs for NTDs and other diseases. Through this public-private partnership initiative, we will remain committed to making a contribution in the field of global health by leveraging the excellent R&D capabilities of Japan's pharmaceutical industry and promoting R&D and the supply of drugs for NTDs, including dengue fever. On the issue of climate change, it is important and indispensable for various sectors to work together. And I'm very looking forward to listening to each of panelists today about their efforts in their respective sectors are making, as well as their opinions on how we can promote cross-sectoral collaboration among us. Thank you very much.
Thank you very much, Junichi-san. And I think I was a very poor moderator. I forgot to ask specific questions to you, but Junichi-san answered very well. So my question here is, we are now focusing on dengue issues, dengue fever, and what is happening to the core target groups of your organizations, and what kind of solutions you are taking to mitigate the issues, and what are challenges for the effective, efficient implementation of the action. And could you please briefly touch on the possible partnership among us or with other organizations? So I will ask to Ana Maria. Sorry, Derek first, followed by Ana Maria and Mora.
So you can hear me now? Okay. So at Takeda, one of our principal philosophies or values is patient trust, reputation, and business. And as a result of that, we believe that partnership, cross-sector partnership, is the only way that we can have an impact on dengue. And I'll give you maybe sort of 3 examples of that. First is around how do we build capacity to generate enough doses to support the kind of impact we need to have. And we've done that with BioE in India. So we'll be making lower cost of goods materials as well as multi-dose vials through a partnership with BioE in India. In terms of evidence generation, I think it's important that we think about how do we show impact, and we're doing that with a city in the west of Brazil, Dourados, where we're working with local ministry officials as well as local clinicians to vaccinate 75% of a city, to compare the incidence of dengue historically, but also compared to a city nearby. So that's not something that Takeda can do by itself. And maybe the third example actually links back to COP and last year's COP. We set up essentially a call to arms, a call to action with a number of parties that are interested in how to manage the burden of dengue. We've actually called that now a dengue collective. We've had a number of meetings since then. We've got a secretariat composed of 11 different organizations. We're in the process of appointing a secretariat to support that. The broader group involves nearly 30 people, 30 groups attended the meeting in COP28. Our next steps are really to focus on urbanization, innovation, and advocacy as the 3 work streams that will be worked on by this collective. So if there's one thing that I'll leave you with, it's just the need for partnership.
So thank you very much. So please.
Thank you very much. And in terms of dengue specifically, I would like to say that Gavi has a modality of work, which is the vaccine investment strategy. That is our prediction of which are the vaccines that are going to be needed in the world, that are going to be part of our future portfolio. So now the board has approved the new group of vaccines that we will fund for the next few years, in the next strategic period, and dengue is one of them. We are very proud to say that from all the vaccines we provide, which are 19, 7 of them are really tackling climate-sensitive diseases like yellow fever, malaria, meningitis A, typhoid, cholera, etc. And dengue will be one of them as well. Another thing to say, which is very important, is although we are a vaccine alliance, we want to solve health problems. And for that, immunization and vaccination needs to be part of broader strategies. So the malaria vaccine is to be part of the malaria control eradication strategy, as well as the dengue. And we know that WHO has recently approved a global plan on preparedness, readiness for dengue and other diseases. And we don't see immunization in that plan, but we want to see it because we're part of that bigger picture. And the last point I would like to make, and that speaks to partnerships, is the value of equity and the purpose and objective of equity that is very much at the heart of Gavi. When I talked about these 14.5 million children, there are children who live in extreme conditions. Probably they not just lack immunization, their mothers lack antenatal care, they lack wash, they lack nutrition, they lack sanitation. So we need to work together to meet those needs. And really the needs of the people who are hard to reach, who many of them live, 50% of zero-dose children live in conflict-affected areas. We need to strengthen primary health care, and we need to strengthen universal health coverage. So the universality of means that we leave no one behind, as the SDG says. And on that, I would like to congratulate Japan for being a global leader in universal health coverage. And we should not forget that the bigger aim is health for all and the right to health. And for that, we need to work all together. Thank you.
Thank you very much. Danilo-san, please.
Okay, this worked well for me again, because then I can just I can just pick off where she left. Yeah, besides vaccination, we believe there is a need to promote community-based solutions, right? So UNICEF has a long-standing global partnership with Takeda, and we have a partnership in Brazil. And the work we are doing is to promote the resilience of children, of children's families, of children's communities. And that has to do with finding young leaders that can promote awareness and school-based initiatives for education at the local level. We have thousands of young people in hundreds of municipalities working on promoting reduction of mosquito breeding grounds and strengthening water and sanitation and raising awareness. And our sense is that work with young people and that work with communities and that work with people in the places where they live is essential, not only to answer to the challenges of dengue and of all the diseases, but also it will be essential to vaccinate as well, because those structures and those systems of support and of mobilization and that community relationship with their own health is part of what we'll need to get people to trust the vaccination campaigns when they come. So it's the same process, right? The process of prevention we are doing now is the same process of building those relationships in the long term that will also allow us to vaccinate children when that's possible. And I think I think it's important for us to keep in mind, within the spirit of leaving no one behind, that some children will be much harder to reach than others, right? You have logistical issues, you have real concern. I was just mentioning the drought in the Amazon. Vaccinating children in the Amazon is already a challenge. Vaccinating children in the Amazon when you can't reach them the normal way, which is by boat, like it's an even bigger issue, right? So we have this. We have to build relationships and to build systems that are strong enough, that are resilient enough, that we will reach everyone we need to reach, and we will reach those that are the hardest ones to reach everywhere. I'm talking about Brazil because that's where I'm based, but that's the same logic will apply to Congo, and the same logic will apply to Indonesia, and the same logic will apply everywhere. We need to build community, and we need people to recognize their health and to know what to do. And my role is to say we need those leaders to include children. We need young people there. They need to be in the forefront of everything we do, not only because they have specific needs, specific vulnerabilities, but because they have specific potentials, specific they have specific ideas, they have experiences that are unique and that can add to the process of building a healthier and more resilient space for everybody. And I think that can only be done together, right? We need governments, and we need companies, and we need the international organizations, and we need those people to be working with and promoting the communities and the local leadership that is essential for results. And I think that's the message I wanted to leave with.
Thank you very much. We really, or at least I really learned today what is happening on the ground for especially children in a very vulnerable areas like Amazon in Brazil. And we really need to know what is happening on the ground when we come up with a solution. Even though we think this is a solution, but if we cannot reach to them, it can't be a solution. So your insights are really, really impressive, and I really learned today. I think we can have a quick Q&A session from the audience. So if anyone have, sorry, Madam, in the back.
Hi, my name is Kira. I'm an infectious disease epidemiologist, and I work on climate-sensitive diseases, most recently actually yellow fever in Brazil. So it was really interesting to hear from you. My question is about the role, particularly like a lot of the conversation today has been around dengue vaccination. And I'm curious how much you've had to take into account the role of antibody-dependent enhancement, who like, for anybody maybe that like isn't like really well versed on like dengue epidemiology, it's one of those like funny diseases where the second time you get it, if it's a different serotype from the first time, it can lead to like a worse outcome, and that can often be the same with vaccination. So as we think about dengue being kind of the flagship climate sensitive disease and how do we address it, there's the like, first of all, let's stop changing the climate so that it doesn't keep expanding, and that's the conversation that's happening all in this room. And then there's the conversation that we're having here about vaccination strategies if we fail to prevent it spreading. But I'm curious what you think about the middle step, which is the climate is changing, the niche is expanding. How do we catch these outbreaks early enough such that we can target vaccines maybe a little bit more strategically? Because while in an ideal world, we would have the money and we would be able to vaccinate absolutely everybody. But like even the science in this case means that like you do have to think carefully because of antibody dependent enhancement before just like blanket immunizing everyone right now. I don't know if that makes sense, but I'm kind of curious what you think about it.
Yeah, so I think it's obviously very important that any vaccine has to be safe. I mean, the principles of vaccination are that you provide something that prevents the potential future disease. So giving it to somebody in the short term needs to be safe. I think that the issue of antibody-dependent enhancement with dengue is essentially a description of what happens with the second exposure being worse than the first, and it's a potential explanation, but it's not the whole story with dengue because even primary infections can be severe. So it's a component of one of the factors that makes some disease more severe. I think the biggest impact is really in the development stage because it means that, for example, Takeda did the biggest study it's ever done in 240 years of existence was a dengue study. It's in 20 different countries. It's 26 different sites, 8 different countries, 20,000 children, weekly contact to see if they've got a fever during that whole time, baseline samples in everybody. And 4.5 years of follow-up before the first registration. I mean, that's an enormous commitment for an organization. And I think actually a Japanese organization has that long-term view. I don't think there's very many organizations that would invest that much at high risk with such a long period of runway before you even get the first doses available. So I think it's very important from a development perspective in demonstrating the safety and efficacy that supports the registrations in the first place. And to do that, particularly for dengue, I think you need large-scale, multi-country studies that go for a long time with baseline samples so you can make assessments based on dengue serostatus. So that's the biggest impact. Of course, with any vaccine, we have to assess after it's launched, what's the safety longer term? And I think there's maybe 3 categories to that. The first one is what's the reactogenicity, short-term fevers, rashes, that kind of thing. Second one is what rare events do you potentially get, like anaphylaxis. So we have seen some anaphylaxis with our vaccine. Brazil has been very mature in the way it's managing that. Essentially, it just means that you need to, watch somebody post-vaccination for a period to be ready if there is an issue. All vaccines have anaphylaxis and the rates look pretty similar. And the third one is dengue specific, and that's where we're looking at how do we do studies to further understand impact, effectiveness, how do we use the vaccine, and safety is always a part of that.
Very quickly, I think part of the answer is in this new global strategic preparedness, readiness, and response plan to fight rising dengue and other Aedes diseases, which talks about strengthening health systems, so making health systems resilient, talk about improving surveillance, improving laboratory, improving community engagement. But overall, I think it's also a matter of providing the services that people in need needs, like, water and sanitation, making sure that they are not, water repositories that will provoke more the growth of the vector, etc. No, but I think the answer is on the more sustainable resilience aspects of how to manage that.
Thank you very much. And other question? I think, gentleman.
Hi, thank you. Matthew Lindley from Unitaid, WHO hosted partnership. I am asking a question because I like the idea of how dengue is going to get a lot bigger. We really need to find what some of the solutions are. And I think this whole kind of way in which it's been presented around adaptation makes a huge amount of sense. And I think the level of work and the intensity has been really impressive. I'm wondering from a mitigation perspective, how you've handled issues around what the kind of carbon footprint is, environmental damage, etc., that can come from the introduction of a new tool like this, and how that's kind of being mitigated so that we're looking for the future as well as kind of today's problems. Thank you.
Whom would you like to ask?
I think there are broader initiatives on sort of managing the climate footprint that are part of what Takeda is doing in all of its manufacturing facilities. So a lot of it is, how do we manage water? We look through our suppliers, the sort of heat pumps and systems for just the heating and cooling, for example, in facilities. So there's a piece that's in facility. There's a piece that is the transport to the site, to where the vaccine is being used. We've had a degree of urgency as we're making the vaccine, we're shipping it out. So at the moment we have an 18-month shelf life, for example. So we've been flying the doses. That's not great for the climate. We've extended the shelf life from 18 to 24 months. That's now changed in Indonesia, in Brazil. That allows us to ship. So we use some of that shelf life now to ship, which is not great, but it's better than flying. And then cold chain is an issue as well. So this is not a cold. This is a heat sensitive vaccine. It's a lyophilized vaccine. So we're still going to have troubles to manage the footprint of that. It's not frozen. It's fridge temperature. But we need to think through from when we're actually making master seed through to when it's actually being given, and then disposal of needles as well. So it is going to be a challenge to get that carbon neutral. But we are looking very hard at it.
Thank you very much. And the gentleman here.
Thank you very much. I'm Hiroaki Shibuya, Deputy Director of APN Secretariat. APN is Asian Pacific Network for Global Change Research. This is about 30 years history about the supporting the research in developing countries and also capacity building in developing countries. So we have 22 countries, but the population is about 60% of the global population. So this includes China, India, and many Southeast Asian countries. And so my question is, so we are a network of scientists and government, but so when private company try to do research and try to vaccinate to children, but our network can support to private company.
Thank you very much. Derek-san, can you?
I think the question is sort of is getting working together early. I think is the need. If we look through the endemic countries that have the vaccine now, they were all part of the dengue vaccine initiative. So the International Vaccine Initiative in South Korea had a thing called DVI, or pediatric DVI, then became GDAC to help with Zika as well. They had meetings every 6 months with the governments, regulatory authorities, sometimes ministries of health, mainly regulators from Indonesia, from Thailand, from Colombia, from Brazil. And so it helped them to understand where manufacturers were in the development of their vaccines. And then we had a lot of support from WHO as well. For example, the Article 58 procedure, the EU M for All procedure, is a regulatory procedure where EMA and WHO help third-party countries to make an assessment. So essentially, we had that. First time ever, it was piloted for our vaccine, where it was in parallel for EMA and other countries. Normally, that's something that involves 2 or 3 other countries, originally for African countries. But because of the history of DVI and GDAC, it enabled many of these countries, Argentina, Colombia, Brazil, Malaysia, Thailand, Indonesia, Vietnam, all these countries that now have the vaccine licensed did that through that mechanism. So I think it's a lot of planning and engagement over time. Countries like India, it takes a bit longer because you need additional data, and so that engagement has started already, but it takes longer to bear fruit.
Very much, yes.
I don't want to be disruptive, but I thought of something while he was speaking that reminded me of something about the other question about mitigation that I wanted to mention, because I think it's important. As Derek was saying, like there are many challenges with the things that you need energy for when you are trying to vaccinate a lot of people, right? The cold chain is an issue, the production is an issue, but in the issue of the cold chain and of getting the vaccination to people, the transportation, all those things, like we have some very smart solutions about, for example, how to generate enough energy from solar energy to keep the cold chain. Like the technology exists, it's just expensive, less expensive than it was a couple of years ago, and maybe it will be less expensive 2 years from now. But the reason why I wanted to mention this is the decisions that are being made on the halls over there. They have a direct application to the answer to that question, because our ability to have systems that will be able to deliver vaccination without emissions depend on the poor countries that are endemic to dengue. The reason I remember this is because he started listing the countries, and like all those countries have a lot of sun. So if you have the technology, you can keep cold chain in those countries without emissions, right? It's just a matter of how do you create those countries are also mostly poor, and they need money to be able to create those systems. So we need the money to exist. We need the money to come to the poor countries, and we need the money to be directed to strengthening the kinds of systems and the organizations and the services that are essential to deliver those things, right? We need to start thinking about how do we send the money to make sure those efforts happen. So I think there is a connection here that needs to be made and needs to be said explicitly, right? She was saying, the first questioner was saying that there's nothing more important than solving the problem itself. I agree. There's nothing more important than actually addressing climate change. And one of the ways we do that is that we make sure that the poor countries have enough money to transition away from fossil fuels. And there is no way to do that. Like there's no way we won't be able to do that fast enough if we don't get that money. So we have a lot of pressure to put on that side of the event as well, because we need results. They couldn't be more urgent on that area as in many others. Sorry, I just wanted to say that.
Can I add just
yeah,
very quickly? Is that so we have a partnership with WHO on mitigation of cold chain and solarization of cold chain. But as you were saying, that's going to be a drop in the ocean if governments of those countries don't have the money to solarize the whole chain. But it's not just about the vaccine delivery, it's about the vaccine production. And then I think the manufacturing industry has a responsibility and a good opportunity for contribution, because developing the vaccine from the research to the production generates carbon emissions. So we need to look at the whole vaccination cycle as a whole and work together to mitigate.
Thank you very much. I think we now stopped our discussion, and I think we had a very good discussion and touching various related issues. I thank all the distinguished panelists and the speakers who brought their thoughts on combating climate-related diseases. As we well know, human health impacts by the climate change are so wide, from direct impacts such as heat stroke to indirect and complex ones, such as infectious diseases, combined with flood risk or food scarcity or malnutrition, and the distributional change of wild animals, among others. So this seminar highlighted the growing impacts of infectious diseases, especially vector-borne diseases such as dengue fever, joined by WHO, Gavi, UNICEF, MHLF, LW, and Takeda, who are working actively to tackle these urgent issues. So it is important to remind ourselves of the fact that dengue is just one of many vector-borne diseases likely to increase as global temperature rise. And the second, vaccination is a part of a broader strategy of immunization and tackling to infectious diseases. And lastly, international cooperation is very, very essential, as no single country or single entity can tackle this by themselves. So I am very grateful and thank all the panelists and speakers and the audience who gathered here and involved in the actively in this discussion. So thank you very much. Have a good lunch.
Thank you very much. Oh, finish. Questionnaire もアナウンスだけちょっとしたいんですけど、なんか。はい。今まだオンライン。はい。Thank you very much, everyone, for coming. And especially for those who are participating, attending online, there is a very quick questionnaire survey for you to answer. That is only 5 questions by clicking, and we would like to have your feedback. And by just clicking from 1 to 10, the 10 level of scales, with as the 10 is the maximum evaluation. So we appreciate your cooperation on answering the questionnaire. Thank you very much for all.